Hey, Dr. Huntington here. In this video, we're going to cover the basics about celiac disease. This is an important topic because statistically, somebody you know suffers from this genetic disease. A little over 1% of people have celiac, but the rate of occurrence seems to be doubling about once every 15 years. Celiac disease is one of about 100 different known autoimmune disorders. And the term autoimmune means that your immune system mistakenly attacks your healthy cells and tissues. With celiac disease, the lining of the small intestine becomes damaged when the body detects gluten. Now, gluten is a protein found in grains like wheat and rye and barley. So gluten is going to be in things like bread and cereal, pasta and pretzels, and many types of crackers, most pancakes and waffles, pizza, pretty much all the sticky, chewy stuff. And while I guess gluten makes baking easier and it can taste pretty good, it certainly is not good for your body. This stuff sticks even in your gut. In fact, it can actually form a mass inside your gut, disrupting digestion. And it can cause painful cramping and bowel trouble. Also, when you eat gluten, it interferes with how your body breaks down and absorbs nutrients. Now, on the membrane lining of a healthy small intestine, there are these finger-like projections called villi. These are like folds that increase the surface area and help nutrients and fluids pass efficiently into the bloodstream. If you have celiac disease, your villi get damaged by inflammation from gluten exposure, and fewer nutrients can pass into the bloodstream. This is a big problem that leads to nutrient deficiencies and other conditions like infertility and osteoporosis. So the problem is in the small intestine, but symptoms are often widespread throughout the body and sometimes won't seem related to the food that you eat. Symptoms can include bloating, gas, upset stomach, headaches, brain fog, diarrhea, cramping, fatigue, skin problems, joint pain, even neurological problems such as ADHD and depression, all from eating this sticky protein. Now, people aren't really born with celiac, but rather a genetic predisposition to develop it. You can develop this condition at any age, so don't think just because you didn't have it when you were younger, didn't have symptoms from it when you were younger, and your symptoms came on more recently, that you can't necessarily have celiac, because you can. Now, early diagnosis is really important so that you can make sure to avoid gluten and make other lifestyle choices that will help you to avoid related problems. Another reason to detect it early is because once you have one autoimmune condition, you're more prone to developing a second one. And these autoimmune disorders attack the body, creating inflammation, damaging the DNA in your cells, and sometimes causing uncontrolled cell growth. Now, a gluten sensitivity is different than celiac disease, although symptoms can be similar. The major difference being the definite genetic component to celiacs. With gluten sensitivity, there are many factors, but genetics is not thought to be one of them. The only treatment for celiac disease is eliminating gluten from your diet, and I mean total elimination. And that goes for gluten intolerance as well. The only treatment and the correct thing to do is to eliminate all gluten from your diet. And many people do this successfully. And it's something that you've got to do if you have symptoms from eating gluten. This is such an important topic that I've created several videos on gluten, so keep an eye out for those. And if you enjoyed this one and you haven't subscribed yet, go ahead and get on my list so I can help you increase your knowledge about food and health.